Hello, my name is Ryota. So I'd like to talk about the anti-cancer effect of non-cyclic retinoid on lung cancer cells. Lung cancer is the leading cause of cancer death and the second leading cause of new cases worldwide in 2020, especially among men. Cisplatin constantly used for lung cancer. Cisplatin is one of the most potential and widely used drugs for the treatment of various solid cancers, such as lung. However, side effects and drug resistance have been a problem. Novel therapeutic agents must be developed to solve these problems. Acyclic retinoid, one of the synthetic retinoid. ACR has been reported to inhibit cell proliferation in cancer cells, including hepatocellular carcinoma and pancreatic cancer. And additionally, ACR synergistically acts with other drugs, such as vitamin K2 and gemcitabine, to induce anti-cancer effects. In this study, we hypothesized that combined treatment to ACR and cisplatin might have a synthetic retinoid synergistic effect. In the next slide, I will show you some literature on cisplatin and the combination treatment of all trans-retinoic acid and cisplatin. First, let's talk about cisplatin. Combined treatment is used to reduce the side effect and of resistant cisplatin. GPX1 loss AKT signaling cascade in NSCLC cells is associated with cisplatin resistance. Second, combination treatment of all trans-retinoic acid and cisplatin. RA has been clinically tested in combination with cisplatin and paclitaxel and has demonstrated promising result in the response of NSCLC patients. However, 10% of patients had grade 3 to 4 hypertriglyceridemia in the RA-PC group, compared to none in the placebo group. The combination of RA and cisplatin significantly reduced the level of phospho-AKT in hepatocellular carcinoma. So in this study, we hypothesized that combination treatment of ACR and cisplatin might have a synergistic effect and delay the acquisition of cisplatin resistance. To elucidate the effect of ACR on lung cancer, lung cancer cell line A519 was treated to ACR and cisplatin, and cell viability and expression levels of cancer-related proteins were investigated. ACR significantly reduced the cell viability of A519 cells in concentration-dependent manner from 10 micromolar. Compared to cisplatin alone, combined treatment to ACR cisplatin significantly reduced cell viability from 25 micromolar. Next, compared with cisplatin alone, the combination of ACR and cisplatin significantly decreased the expression of pAKT and increased the expression of p27 and pARC and ARC2. So I'd like to summarize the main finding of this study. ACR affects levels of expression and phosphorylation of cancer-related proteins. In addition, cell viability of A519 cells treated combined treatment with ACR plus cisplatin showed significantly lower than that of A519 cells treated with ACR. Activation of ARC by cisplatin has an anti-cancer effect via p53, and ACR might enhance this effect. The inhibition of AKT activation in combination with ACR might delay the resistance acquisition. Thank you.